Welcome to Preserve Health Talks, where we explore different ways of thinking about health, disease, and longevity. Today's conversation with you will be a little bit provocative. We're going to explore naturopathic medicine, what it is, what it isn't, and how it differs from what I do, allopathic medicine, the medical model that most Americans are familiar with. I'm joined today by Dr. Dana Michaels, a naturopathic physician who earned her doctorate of naturopathic medicine in 2009 from Sonoran University of Health Sciences in Arizona. It was a 4-year in-residence medical program with over 4,100 hours of classroom and clinical training. And prior to medical school, Dr. Michaels completed a Bachelor of Science in pre-med biology while also studying studio art, which is really impressive, at Humboldt State University, now called Cal Poly Humboldt. Her training spans biomedical sciences, diagnostics, alongside natural and integrative therapies, including clinical nutrition, botanical medicine, physical medicine, vitamin injection, IV therapies, environmental medicine, detoxification, lifestyle coaching, and mind-body counseling. And myself, as an allopathic physician, my approach to medicine, as you know, because most of you are my patients, is quite different. And that difference is exactly why today's discussion matters, because we're going to talk about how naturopathic medicine approaches common conditions and treats them differently. Conditions like high blood pressure, diabetes, cardiovascular disease, thyroid disorders, and I guess even cancer.
Absolutely.
And we're not going to shy away from areas of disagreement on treatment approaches. So welcome to a controversial show, Dr. Michaels. We're glad to have you here.
Absolutely. Welcome. Thank you for having me.
So what brought you to Florida?
I wanted to be closer to family. My license is in California, and I've spent the last 16 years there, and I miss the East Coast a little bit, and I have a lot of family here, and I wanted to see them more.
Now, you're actually licensed in California.
Yes.
And not licensed in Florida.
No. So naturopathic medicine is licensed in 26 states currently. Just to plug the bill for Florida, if you like what I have to say and want to support us, a bill is being up for licensure in the state of Florida, and it's bill, reach out to your congressman, it's bill 223.
Okay, so bill 223. And educate me here, as a naturopathic physician,
yeah,
you're able to prescribe, you're not able to prescribe. How does that work for you?
So each state has its different scope and different laws, and there's different levels of prescriptions, and in certain states we can do more, and in the state of California, just low levels, basically hormones. But other states have more prescription rights, like Arizona, and where the schools are, especially.
So because you're here and your patients are there, can you only treat patients from California, or can you treat anyone? How does that work?
Right. So in Florida, I see people who are clients, and I do basically the same, very similar work with the patient, but they are considered clients. It's under consulting. I am not able to prescribe, diagnose, and my treatments are recommendations. As long as we get that out of the way, we can do basically the same work.
Okay, got it. So in plain terms, when a patient walks into your office, what makes a naturopathic visit fundamentally different from what I do?
Well, let me just back up and say about what it is. Naturopathic medicine is.
Sure.
So I went to a 4-year medical school and our practice is based in 6 philosophies. And the first one is that we believe in the vis, which is Latin for vitality. We know the body can heal itself. If we give it what it needs and remove all these obstacles that are in its way, it will do what it wants to do. It doesn't want to just survive, it wants to thrive. But we have to give it the tools. And for that being said, you come in and I see you for an hour and a half to 2 hours where I get to learn the whole person. Our investigation is looking for the underlying cause. It's individualizing healthcare. And so I want to know about, the pain that you have. I want to know what you came in for, but I also want to know about the fungus on your toenail. I want to know how you sleep at night and how you deal with stress. I want to know what your poop looks like. All of these things are connected and are symptoms of what's really going on. And that takes time to figure out.
Okay, so where do you see your role as a naturopathic physician overlapping with my role as an allopathic physician?
We work alongside each other. There is a place for us. We're not in competition.
Gotcha.
What I do is really help find the underlying cause, and that once again takes time. I need to see someone and talk with someone for a good amount of time to figure out what's going on, and I want to once again individualize care. So if someone comes to me with hypertension, or then 10 people come to me with hypertension, 10 people go home with different treatment plans because they're different people. As Hippocrates says, it's more important to know about the person that has the disease than the disease the person has. So I don't treat conditions, I treat people.
Okay, so you treat the whole person, and from your perspective, what does conventional medicine tend to miss when it comes to chronic diseases?
Well, I'll give you an example of a patient I had. An older gentleman was brought in by his daughter, who was a patient of mine for many years, and he hadn't had more than 2 hours a night of sleep since his wife died a year and a half prior. And he went to 5 or 6 different doctors, MDs. He's tried 8 or 9 different medications. He didn't like the side effects. It didn't work. He still was not sleeping, and his health was deteriorating. When he came and saw me, we spent time talking about everything that was going on. And I wanted to address his neurotransmitters balancing, because it's a lot of stress for a long period of time to lose your significant other, and how the person was sick before also is a lot of stress. And when we're in fight and flight, we don't always feel the symptoms until that stress ends, and then we become back into our rest and digest mode, our parasympathetic mode, and that's where we sometimes crash and burn. And we feel the damage that's been done. And so we looked at his neurotransmitters. I also wanted to heal his gut. And at first he was like, no, it's not my gut. That can't be. I'm not sleeping. So we focused on the neurotransmitters, the cortisol, the hormones, and that did help. And he was then sleeping 4 to 5 hours a night. And still then now was a little bit more open to natural and alternative therapies, tried a bunch of other things like ketamine drips and other acupuncture. And then it came back to me and said, maybe it is my gut. Let's work on that. And I was happy to do so. And we saw a lot of bacterial overgrowth, some digestive enzymes that weren't produced, because once again, a lot of us, we live in fight and flight. I hear that so much. We all live in fight and flight, but what you're not thinking about is that if you're in fight and flight, you're turning your gut off. You're not rebuilding, you're not regenerating, you're not detoxing. And years of that will have a lasting effect. And so after we treated his gut, 2 months later, he was sleeping 7 to 8 hours a night and changed his life.
So you're basing it on the gut biome affecting overall health.
It can.
And things like sleep, energy levels.
It could affect everything.
Well, let's talk about blood pressure. Mm-hmm. Let's talk about diabetes. For me, when I manage blood pressure, it's with medications. There's several different pathways in the body. We deal with different catecholamine surges, epinephrine, norepinephrine.
Yep.
We want to block those surges. We also want to block the renin, angiotensin, aldosterone system. Mm-hmm. How do you approach that differently?
So we, as naturopathic doctors, and I, want to support the body's natural processes. So we're not trying to block. We're trying to support. So I'm gonna do some functional medicine testing first, but I want to see where their serotonin is and where their GABA is. So a lot of us don't have a lot of that. That's why those serotonin inhibitors are so popular. But we can naturally support our body's making of that. And once again, it comes back to the gut. I often say, because people refer to our gut as our second brain, I think it's our first brain. Because if that's not working, this one's not working.
Okay, but you're monitoring vital signs, correct?
We have vital signs,
All right, so
blood
someone
work,
walks into
but
your
functional
blood.
medicine testing too.
All right, well, let's just say someone walks into your office with a blood pressure of 180 over 100. They've never been on blood pressure medications. They didn't know they had high blood pressure. What's your initial approach?
Well, that's not the only thing I'd be looking at. I would look at everything. If it is an emergency, I would refer out and get them settled for temporarily. And then we could work on things, because what I do is I'm healing the body. It takes time. It doesn't happen overnight. And we're all 1,000-piece puzzles. I want to address many pieces at once, not just one piece.
So how
But that might be a time in place where medication, and it's not an it's a Band-Aid, right? We want to heal the bullet wound. So we want to make sure that the person is healing, and that's not just looking at one number of their high blood pressure. I want to test their vitamin D, their B12. I want to look at their neurotransmitters. I want to know if there's other things going on. What's the cause of that elevated blood pressure?
Well, let's talk to our audience here for a second, because you've used a lot of big words, and let's define them a little bit.
Sure.
Let's talk about the whole neurotransmitter thing.
Yes.
Neurotransmitters, what are they, and what are you actually looking for?
Well, we have hormones that are stimulated when we have a stress response, cortisol, right? Cortisol will tell us, hey, we're in stress, and then our neurotransmitters our body will decide if we're going into fight, we're going into flight.
So which neurotransmitters? Epinephrine,
Norepinephrine, dopamine, glutamate,
serotonin.
Well, serotonin and GABA are the inhibitory ones. Those are the ones that most people have that are really low, and we need to stimulate those, because that's what we need to bring us out of our fight and flight.
Okay.
So we're not staying in there. We have something stressful in the morning, and then we're all anxious all day. That means we don't have the inhibitory or the calming neurotransmitters to bring us back to where we're in that digestive mode, that regenerative mode, that detox mode.
Okay, so you're a naturopathic physician. So what are you doing that's actually different? Because we've had functional medicine physicians on this show. We had Dr. David Billstrom from Utah. He's a pretty world-renowned functional medicine specialist. What are you doing that's significantly different than what he's doing?
Well, I don't know a whole lot about how he practices, but I'm sure there are some similarities. I do support testing. Functional medicine testing is very important. Anxiety can be caused by too many or too much of something. It could also be caused by too little of something. So we want to know specifically what's going on. So I do think functional medicine is very important. How we go about treating, I want to make sure that the person is fully supported, not just what says on that paper, but once again, it's about treating the whole person. I want to make sure they're sleeping. I want to make sure their guts functioning optimally. We're not just what we eat, we are what we could absorb and what we could eliminate.
Okay.
I want to, we'll talk about diet. If someone comes to me, like for instance, that patient I was giving an example for, no one of the 5 doctors that he had before sat him down and said, hey, you got to drink some water. No one told him that a half a glass or a glass of water isn't enough, and you should be drinking half your body weight in ounces. No one took that time. So I address the whole person and making sure that as many pieces of that puzzle is being talked about.
Okay, let's take diabetes as an example.
Sure.
So, Western civilization, we have a horrible diet. Type 2 diabetes is pretty rampant. We have more type 2 diabetes in this country than anywhere else in the world. The guidelines are pretty rigid for both type 2 and type 1 diabetes. Type 1, you're insulin dependent.
Yes.
Type 2, you're insulin resistant. Okay? Basic definitions. But you're not going to use insulin, and you're not going to use regular medications initially.
That's not true.
Okay, but Okay, so how would you approach it initially?
I mean, if someone doesn't have insulin,
Okay.
they need the insulin.
Okay,
So there's a time and place for medications.
Okay.
But I wouldn't only address that. I want to make sure they have supportive nutrients. I want to make
Gotcha.
sure I want to make sure that their nutrient levels are optimal. You know, I hear this more I never use the word at fine in my practice. It's a 4-letter F word. I want people to be optimal. I want them to thrive, not just survive. So we're addressing vitamin levels. We're doing supportive herbs. It could be homeopathic, diet is a big part of it. And and also what I'm really good at is helping people understand these complex issues in a very easy, casual way. You know, I talk about the gut a lot, and I talk about how we're a big donut, and the inside of our gut's still the outside of our body, and there's this ecosystem in there. And our body, to get things into the donut, I just want people to really understand, because I'm not the boss of them. I'm a tool for them to use. They're the ones making the decisions, but they need to have the positive and negatives of what's going on, and I want them to really understand how their body works, what's not working, what treatments I'm suggesting, and what that's going to do, so they can make the decisions. And knowledge is power. If you just tell someone what to do and give them something and they're like, trust me, I'm a doctor, that's only going to last so long. But if they really understand what it's doing, that's motivation and it's power.
okay, well, let's get a little controversial.
Yeah,
Are you okay with that?
I'm fine. Let's
Okay,
do it.
great. So we base what we do on evidence, clinical studies. I practice evidence-based medicine. If I don't have a study that backs up what I do or what I prescribe, I don't do it. Okay? You might call that, I don't think out of the box a whole lot.
No, not at all.
But you're approaching things a little bit differently. So here's the question. Critics say that naturopathic medicine cherry-picks studies and relies too heavily on supplements with weak evidence. Is that a fair criticism?
Absolutely not.
Why?
We are evidence-based. We but we don't look at research that are just about medications. We're looking at research for herbs, for homeopathics, for diet. We're actually including more research than generally often MDs might.
Okay.
But we are evidence-based. We mix science and evidence-based with modern medicine with ancient wisdom.
Now, you mentioned a lot of terms like leaky gut and fatigue and neurotransmitter imbalance, but they're still somewhat controversial in regular, or I don't want to use the word regular because what you do is regular for you. So let's just say in allopathic medicine.
Sure.
So are people like me, MDs, behind the science, or are naturopaths getting ahead of the evidence?
We're using the science, and we're spending a little bit more time with our patients I mean, you can't help someone with leaky gut in 5 minutes or in 15 minutes. We need to look at diet. We need to look at we need to test the biome. A lot of the GI testing I do doesn't just test the biome, but it tests the pH, tests the digestive enzymes, the inflammatory markers. So we look at a very wide picture of what's going on, and that takes a little bit of time, but we are creating healing. Once again, your gut is your first brain. If that's not working, then we're wasting our time. I'm not going to give you, $300 worth of supplements every month if you're not absorbing anything and not absorbing that salad you ate and that the proteins that you're eating for dinner.
Okay. Cancer's where the stakes are really the highest. You miss it, people die. Do you believe naturopathic medicine has a role or strong role in treating malignancy, and where do you draw the ethical line between supportive care and replacing standard oncology treatment?
Well, one of the philosophies is doctor is teacher. And it is so important for the patient or the client to know the benefits and the risks of both, of all sides. And there are a lot of options, and I have a lot of experience with oncology, and it is really up to the patient what their decisions are, but they need to understand what the risks are. A lot of what I've done in the past is along with their chemo treatments to also promote the body's natural immune system to do. I've done a lot of high dose vitamin C IVs, which I'm not able to do here. There's things that we can do together that helps the body. I mean, once again, if you're vitamin D deficient and that's not getting tested, that's a big part of what your immune system isn't doing. It doesn't have the tools to fight. And even, chemo, it can be very toxic and hard on the body. We want to make sure that you have the tools that you can recover and not let that affect the healthy cells.
I think it's a very fair appraisal. So I think what you're promoting here is not separating the two, but working together.
Absolutely.
Enhancing the immune system, if I understand you correctly, while the patient is going through standard oncologic treatment. Correct?
Absolutely. I mean, I've had patients who do not want to do that, and that is fine. We have lots of options for that as well, and very effective as
Okay, well, let's segue that into the question that some doctors, and I'm trying to be very open-minded here, that some doctors argue that naturopathic care can delay life-saving treatment. How do you respond to that concern?
I mean, if it wasn't, if they weren't HIPAA protected, I'd give you 100 names right now who have told me that I've saved their life.
Okay. So how should, keyword should, patients distinguish between evidence-based naturopathic care, which is what you're doing, and experimental therapy, and who decides where that line is drawn? That's a tough question.
Yeah.
I wanted to end it with a tough question.
I mean, do you have an example of what an experimental therapy is? I mean, there is so much of what I do that is research-based, evidence-based. And
yeah, fruits and nuts and Laetrile for pancreatic cancer.
Right. Well, once again, I address the whole person. We're not just doing one thing. I mean, there's so much information out there, and it might be true that this nut is good, it has anti-cancer properties, but that's not the only thing that person should be doing. Once again, we got to make sure that the basics are functioning at a high thriving rate. Once again, we want people to thrive, not survive. And our bodies are so capable. We just have, in our world today, we're so overstimulated. We're malnourished. We need to get our body to have the nutrients in there and to live in this calm, functioning state where we are basically healing. And we can heal from anything if we have the tools.
Well, doctors have a tendency to be a little egotistical. So if we took ego out of medicine, what would an ideal collaboration be between naturopathic and allopathic physicians? And what do you think that would look like?
I've worked with both sides. There are a lot of MDs I've had patients go to, and they're like, I'm not even telling them that I'm working with a naturopath. And that just does a lot of disservice for the patient. We should be working together. There's a place for both of us. And there are the MDs that I really appreciate that are open-minded. They're like, this is something I don't know a lot about, but I see it work. And so they're open to the idea that these two things can exist together and for the benefit of the patient.
I think that's excellent. You've been a great guest. So, folks, medicine isn't monolithic. Allopathic physicians, such as myself, are trained to diagnose disease and intervene decisively, often saving lives. Naturopathic medicine challenges us to look upstream, focus on prevention, and individualized care. No single model has all the answers. Patients, like yourselves, are complex, and meaningful health often exists at the intersection of prevention, science, and personalized care. Conversations like this move us away from either or thinking and towards better collaboration, clearer boundaries, and more informed patients. Dr. Michaels, thank you so much for joining us and for engaging us in this discussion with honesty and professionalism. It's been a pleasure having you here.
Thank you for having me. I appreciate it.
Thank you. We'll see you on our next episode.